Clinical exposure. You are going to argue throughout your application that medicine is your passion and calling. It's almost impossible to make that argument if you have no or minimal clinical exposure. Almost every admissions dean or director I've interviewed, actually all of them, have said it's required to get in. First, let's start with the basics. What is clinical exposure? It is an activity that puts you in contact with patients, their families, and other healthcare providers or caregivers. It gives you insight into the joys and demands of medicine. It can be paid or volunteer, and it can include activities like scribing, phlebotomy, ER clinic or hospice volunteering, becoming an EMT, medical assistant or med tech, and many, many other activities. The key is patient contact. How much do you need when applying to medical school? Some say there is no minimum, which I disagree with. Zero clinical exposure, in my mind, is a recipe for rejection. Others recommend a minimum of 200 to 300 hours of either paid or volunteer clinical experience. Obviously, more can only help support your argument that clinical practice is your calling. Shadowing is one kind of clinical exposure. It is a good place to start your exploration of medicine, but don't limit yourself to shadowing. While some medical schools really value it, others feel that it puts the shadow, i.e. you, in a passive role where no one benefits but the shadow himself from the activity. Others say it is an activity that reflects privilege and connections, and that not everyone has those connections. I'd recommend 30 to 50 hours of shadowing because there are schools that really do value it. But most of your clinical exposure should be in roles where you are doing something and you are serving and helping others. In other words, it should be active. While I have given quantitative guidelines for both shadowing and clinical exposure, please don't view any of these activities as merely items to check off your to-do list. Quality counts too, as does a record of demonstrated and consistent interest in medicine. Working as an EMT or med tech is more valued than carrying lab samples between the ER and the lab, or pushing gurneys, although the latter is also clinical exposure, and a consistent multi-year record of clinical volunteering is valued more than a one-time 3-month stint of full-time work, if that's all you have. Again, don't think about med school requirements as merely box checking. If you are applying to DO programs, not MD programs, then try and get some experience either shadowing a DO or some exposure to osteopathic medicine before you apply. Such exposure will add a lot when you are asked why you are applying to osteopathic medicine or to become a DO. Finally, in your clinical activities, select those that you will enjoy and that will give you exposure to different areas of medicine. For example, you want exposure to primary care and a couple of different specialties, maybe the hospital setting as well as medical offices or clinics. You don't have to divide your time equally, but diversify your perspective a bit. So for example, if you scribe in a cardiologist's office, then maybe do some shadowing of primary care physicians and volunteer in a clinic for the homeless or for drug addicts or something like that. So that you have different perspectives, you also show a willingness to serve different populations. Now this video has focused very much, exclusively really, on clinical exposure. Many schools also want to see a commitment to service beyond the clinic. Specifically, they want to see community service, and that's the topic of our next video.